And thank you, Dr. Wei, for inviting me. It's so nice to be here at this center where the kinds of work you're doing is very similar to the kinds of work that I have been doing for a long time, and yet very unusual in the general landscape of academic work, I think, at least as I see it. So it's really nice to feel at home here. So I'm going to talk about heat waves. And I'm going to talk about really two facets of heat waves. One, how vulnerable populations respond to the risk of heat waves. And so I'm not a total Debbie Downer. I'm going to talk about a second project, which is very much in the early stages, which is how we might be able to use biosensors to decrease risk and increase resilience. Okay, all right. So I'm going to start with a little quiz. How many people died in the 2003 European heat wave? I'm going to give you three options. Raise your hand if you think it's A, 250 to 300. Okay. B, 10,000 to 12,000. Or C, 50,000 to 70,000. So we have one person, thank you, who has the correct answer. It's C. 50,000 to 70,000 people died in the 2003 heat wave. This is something that most people have no idea, right? In the US, there wasn't a lot of press here. But in Europe, it caught a huge amount of attention, has engendered a lot of action, particularly in France, where the largest proportion of heat deaths occurred, and has really ignited the attention of disaster managers and planners, particularly in the US and Europe, as well as in countries around the world, who are very concerned that this might happen. This extremity of a heat wave might happen here and in other countries. So heat waves have been increasingly causing morbidity and mortality around the world. This photograph is from the 2003 Australian heat wave, which actually took place at the same time as wildfires and drought, and drove wildlife into the oceans for reprieve from the heat. This photograph here is from the Russian heat wave, which also was combined with wildfires just a few years ago, resulted in about 15,000 deaths. And to continue backward in time, this photograph is from the 1995 Chicago heat wave, which caused around 800 deaths. And 1993 Philadelphia heat wave, which caused around 115 deaths. Now, to bring it back to the present, last summer in DC was very hot. Does everybody remember that? It was the hottest summer on record. June was the hottest month ever recorded. So the last 9 of the last 10 years in the United States have been the hottest years on record. So we are increasingly facing increasing both average temperatures as well as temperature extremes. So researchers are beginning to try to link temperature change with climate change, and it's, as you probably well know, it's very hard to say that any particular outcome, ecological or social, is a direct impact of climate change. And yet some researchers are beginning to be willing to take the step forward and say certain proportions of heat waves are actually caused by climate change. And this is true now of the Russian heat wave, as well as actually last year's heat waves and heat increase. So the IPCC, the Intergovernmental Panel on Climate Change, is saying, as well as many other researchers saying, that climate change is projected to increase in overall average as well as intensity of extreme heat events. And so you might hear me refer to heat waves as extreme heat events. These terms are all interchangeable. And heat waves are projected to increase 100-fold by 2040. So this is less than 30 years. We're looking at something like a 100-fold increase. So this is one of, I would say, our biggest concerns about impacts of climate change is heat waves. And yet it's something that we're not yet devoting a lot of attention to as a disaster response community or even as researchers. So to give you a little bit more specifics, has everybody seen this graph before? The famous hockey stick graph that projects IPCC scenarios of development. As we heard earlier this week, this is the trend the highest growth scenario trend that we've been on, and as we heard earlier this week, we just passed 400 parts per million. And this will fluctuate a little bit. We'll come underneath 400 and we'll go above 400. And this is a particular note for concern, because what this in part indicates is that we are going far beyond what we originally projected, which means that some of these facts that I'm going to point out to you are probably underestimates of what we're expecting to see. So the IPCC says that it's virtually certain, and who here is familiar with this IPCC certainty language? So this is the most certain we can get, virtually certain, that an increase in frequency and magnitude of temperature extremes will occur. So based on the highest growth scenarios, the IPCC says that a 1 in 20 year hottest day is likely, now this is slightly less certain, is likely to become a 1 in 2 year event by the end of the century. So we're looking at these extreme heat events that we see very occasionally becoming quite common. Now, heat waves have impacts on health and on multiple other sectors. In the United States, heat wave mortality is greater than all other disasters combined. Before I started working on heat waves a few years ago, I had no idea that heat wave mortality was so big, because we don't actually hear that much about it, right? We also see increasing individual level stress during heat waves, increases in crime. So these are some of the social dimensions, as well as economic impacts of heat waves in the US as well as internationally. We see impacts on agriculture. Often heat waves are coupled with drought, as well as lost productivity and stresses on infrastructure and energy. So for example, during the 2003 heat wave in Europe and France, a number of the nuclear facilities that were powering their grid went out because the water was too hot for the nuclear facilities to be able to function properly. So this had a tremendous impact outside of the bounds of what they might normally expect from a heat wave. Now, some of the, that first number I cited you, 50,000 to 70,000 on the 2003 heat waves, pretty soft, right? There's a 20,000 gap there of potential mortality. We're actually quite bad at measuring heat wave mortality. It's very hard to do, and I'm going to show you why in these next two slides, or I'm going to give you one example of why. So I'm just taking 2006 as an example to show you the two different ways that we calculate heat waves. So in the United States, heat wave mortality. In the United States, does this have a thingy on it? Oh, it does. So you'll see that this number is 253 as calculated by CDC. Essentially, there's mandatory reporting from all states on mortality, so it's aggregated from localities as reported by medical examiners and coroners who are actually not trained to identify heat wave deaths. There's no standard definition employed by medical examiners and coroners. So this is a very rough estimate. We'll see the same year, this is a very recent analysis also by CDC that is clearly estimating a lot more deaths. This is separated by male and female. So we're looking at something closer to, I would say, 1,000 deaths for that same year. So we are really, at least in the United States, and I would argue many other countries, having a hard time understanding how heat actually affects mortality and morbidity in general, looking at these kinds of estimates. We do think so far that there are particularly vulnerable populations to heat waves, so in particular older adults, people over the age of 65, children, particularly under the age of 5, as well as people with comorbidities, diabetes, heart conditions, etc. People of lower socioeconomic status tend to live in areas with higher temperatures, and I'll talk about that a little bit more in a moment. As well as people of lower educational levels tend to have been statistically correlated with higher heat wave risks and higher heat stress areas. And we've also seen in landmark books such as Kleinenberg's heat wave study that poverty, crime, and social isolation in particular are result or increase in increased risk for heat waves, because these are areas where, for example, as Kleinenberg outlines, people don't want to open their windows in order to ventilate their homes because they're afraid of the crime outside. And also in the case of Chicago, that his case study explores, there's often a very uncoordinated city-level response to extreme events like heat waves. And I'll talk just a tiny bit about my research on that in the coming slides. Now, the United States has been attempting to begin to prepare for heat waves. The National Oceanic and Aerospace Administration has committed to developing heat wave warning systems for cities over 500,000 people. They've had difficulty garnering the resources in order to be able to do this, but have begun to make these plans. And as the IPCC emphasizes, national systems are at the center of capacity building and meeting the challenges of heat wave preparedness. And I want to point to two pieces. This is one page from the EPA handbook on heat waves. And I want to point to what they emphasize on reaching out to the public, both through the media, information campaigns, as well as operating community centers, new cooling centers. These are two of the fundamental pieces that I've seen in my research, as well as EPA is emphasizing as strategies to be prepared for heat waves and to prevent heat wave impacts. And this is all an attempt to increase resilience, and probably you here in this audience have seen this definition and like 15,000 other definitions of heat waves, of resilience, and so we're not going to have a debate about if this is the correct definition. I'm just going to keep going. But it's an attempt to decrease vulnerability and increase resilience of particularly vulnerable populations. And yet these efforts have been very hampered by a number of factors. There's really a lack of awareness of heat risks, particularly on the part of vulnerable populations. So in research to date, of which there is actually very little, we've seen that the most vulnerable populations are not changing their practices during heat waves to decrease their risk. 25% in one survey of those without air conditioners said they would refuse to go to a cooling center in an emergency, and 22% would ask for assistance with cooling and hydration. So we're looking at a range of responses here. Even in response to targeted messengers, some seniors do not change their behavior. And so we're looking at potentially those messages that EPA is saying we should send out falling on deaf ears. So what else should we be doing? Well, in particular, as I mentioned, people low socioeconomic status living in high density environments, such as those in the urban heat island areas, are a particular risk. And so we're really most concerned about heat waves in cities. Have any of you seen this diagram before? Okay, great. So one of you, so essentially what takes place, and this is really common sense, is in high density environments where there's a lot of concrete that will absorb heat during the day. This heat actually does not get released, or gets released very slowly over time. So these areas in cities can be higher than average temperature by 8 to 10 degrees above average temperatures. This is also particularly important because human beings need to cool down at night, even if we're not cooling during the day, just in order to be able to thermoregulate properly. And when you have this kind of environment, you're unable to cool down during the night because this is the time when this heat is being released out of the concrete, out of these dense urban environments. So now I'm going to get to my research, and I have not been looking at my time at all. So I'm just gonna keep talking, and please do interrupt me if there are things that you want to ask as I'm going along. I should have said that before. So first, I'm going to talk to you about one project entitled "Reducing Social Disparities of Heat Waves in a Changing Climate." This was a CDC-sponsored project run by the University of Michigan, Marie O'Neill, and the School of Public Health, and I and several other co-PIs. It's really a qualitative study. The quantitative piece looking at meteorological triggers of heat health warning systems, including in particular temperature and air mass, and tracking these meteorological factors with excess mortality, especially between 1989 and 2000. And then a qualitative piece, which is a four-city case study, which is really what I was working most on, as the qualitative piece, looking at existing mitigation and adaptation strategies and barriers and catalysts to the adoption of these strategies. So the research aims of that project were to really look at the translation of heat waves interventions in 4 cities, and the cities were New York, Philadelphia, Phoenix, and Detroit. So we had a lot of diversity geographically as well as demographically. And secondly, to identify facilitating and impeding factors to the translation of mitigation and interventions to address vulnerable populations in particular. So all the folks that we were looking at were those over 65 and living in these high-density urban environments. We did semi-structured interviews with community members in these areas, as well as with government and community members working on response measures across these cities. And we came up with a number of results, which I'm just going to brush across the surface of by showing you some specific quotes from community members in particular. So the number one thing that we found, I would say, is that people think that vulnerable people think they are not vulnerable. So this is an excerpt from an interview with one of our community residents, and the interviewer says, in general, how would you say hot weather affects you in your daily life? Not in any way, says the respondent. Not at all. Doesn't change your behavior in any way? No. So this is representative of many responses that we had where people simply felt like it was not something they were aware of. Even when they were, it was not something they would do something about. And so our results are reflecting other work that has been done as well. Even when people are aware, they're extremely concerned about, for example, using air conditioning or attempting to get to places that are cooling facilities because of economic constraints. So this community leader says, I think it's that the image of people who are affected by heat, it's like, they're socially isolated, but they also, maybe they had air conditioning and they weren't using it because they didn't want to pay for it. And this is something we saw over and over again in our interviews of community residents where they were saying, you know what, I can't turn it on because I can't pay the bills. And this is even in cities where programs have been developed, collaborations between utilities and city governments, where the utilities have agreed to leave the energy going even in homes where they're overdue on their bills or otherwise they would be shut off. Residents are still not using their air conditioning. Even when people might want to go to a cooling center, a number of them had difficulty getting there. So one community resident says, if it's 80, I'm not going to go out because my car is down, so I kind of have to walk everywhere I'm going, or my daughter will have to come get me, and I don't want to bother her because she has kids that go to school. And so folks might say, well, I should go to a cooling center, but I don't have a way to get there. I don't want to go stand outside in the hot sun and wait for the bus. I'll just stay at home. So even if we provide these cooling centers, as EPA has recommended, and actually many cities are doing, there are obstacles to community residents actually getting to these places. So we're looking at inaccurate risk perception by vulnerable populations, economic barriers to air conditioning use, lack of transportation, other difficulties with cooling centers. So a number of people who we interviewed across these cities said, well, you know what? I don't want to go to the cooling center because there are homeless people there. There are preconceptions and stigmas of the attendance of these cooling centers that keep vulnerable people out. And there are also additionally misuse of fan programs. Fan programs are actually pretty common in some of these cities, so city governments are actually giving fans to residents who want them. It's like, first 300 people that show up will give you a fan. Problematic though, because as I mentioned earlier, people not wanting to open their windows. If you don't open your window, you sit in a closed room, hot closed room with a fan on, you're actually creating a convection oven in your own home. So you think you're getting cool, but you're not. And so it can actually kind of increase risk in a way that's clearly incredibly problematic. Now, there are some positive sides. Some people are able to rely on their social and familial networks to be able to help decrease their risk. So one community resident said, my daughter, she calls me and she says, Mom, I heard the news. Be on alert and see what's going on. And so she says, it gives these recommendations. Wear light clothing, don't walk. She always say, take your umbrella if you're going out in the sun. And I say, I have my umbrella. And so social networks and social capital are some of the factors that we rely on to increase resilience of these vulnerable populations. And city planners, and we actually did a lot of research around what city planners are doing in response and try to address these vulnerabilities are really trying to make a dent in these problems. And one of the ways in which they feel that they're able to have an effect is to increase involvement of the very populations who are vulnerable in their planning. So one government employee said, we try to change the culture where we capitalize on that experience rather than patronizing the population. And as you might imagine, because many of these populations are over 65, there can be this kind of talk down to, oh, these vulnerable people, and they need to learn how to, you know, et cetera, et cetera. And what they prefer to do is to work with older adults. And as this government employee says, we find it very helpful when they get involved, not when they're treated like frail people incapable of taking care of themselves. So there's an attempt to begin to figure out how to empower these populations.